Morning, everybody. I am the MCA policy lead and DoLS policy lead at the Department of Health. That always sounds very glamorous and looks quite good on my CV, but I'm also the only member of the team at the Department of Health. So we'll look good in future interviews, but on a day-to-day basis of managing the workload, especially over the last year, it's not been a fantastic state of affairs. But I've worked in various places over the departments. They do like us to move around at the Department of Health, so I started off working for the Chief Medical Officer on the swine flu pandemic. Then I worked in setting up an academic research collaborative around public health. Then I went off to the WHO, the World Health Organization, where I worked on polio eradication for a while. And now I'm back working on social care, mental health, and leading on DoLS and the MCA. So I know some people in the audience might be thinking, great, another person from the Department of Health who knows nothing about this subject area whatsoever. And I hold my hands up. I hope I'm becoming a little bit more knowledgeable about DoLS and the MCA as time goes on, but I think there is a benefit to being a bit of a generalist, which is that it means that providing you don't decide that you're the expert on it just because you've read a few Wikipedia entries, that it means you have to get out and kind of actually talk to the people who are the experts and build up a bit of a consensus view from that. So it's good to be here today, not just because I was able to stay at my parents' house last night and go. So good to be here. So I am the MCA lead. So I started a couple of months before the House of Lords report on the MCA, and obviously before the Supreme Court judgment. And so my big job objective that I was given when I started was to really try and do some more on the Mental Capacity Act. We were aware that the House of Lords was likely to be critical in what it had to say about implementation of the MCA. It turned out it was extremely critical about implementation of the MCA, so my job was very much to push that big agenda, knowing that there's potentially 2 million people at any one time in this country who lack capacity, and as the House of Lords reported, not receiving their rights under the law, many of them not getting the person-centred care that we would expect, not having their wishes, their unique wishes and values taken into account, and just being treated as objects shuttled around the system. So I think it's important to recognise that DoLS is a part of the MCA. At times it feels like it's just this add-on, and I know it frustrates lots of people whose job titles say MCA DoLS, that they are focusing far too much at the moment, they feel, on DoLS and not on that bigger picture. But DoLS, I think, and the reaction to the Supreme Court judgment can be a positive thing in helping us to deliver this care and support to those who may lack capacity. And one of my big sells when I'm trying to go around other parts of the department and talking to the people who lead on dementia, big team that leads on dementia, and we talked about the Prime Minister's challenge on dementia, big team that leads on learning disabilities, aftermath of Winterbourne View, and big team's policy priority around end-of-life care. I'm always trying to tell them that whilst I may be the only person at the department who is allegedly leading on the MCA, I think everyone in those teams is leading on the MCA, because essentially we're all trying to push forward the same agenda. So I don't go around trying to say, this is the MCA, do it because that's what you're supposed to do. I try to very much say, we know the culture change we're after, and in the MCA we do have a tool, a law, that will help us to do this. It's not going to be the kind of magic bullet that solves all the problems, but I do believe that if people are more aware that we have a law that encapsulates those principles, it will be one of the strong tools we have to pushing the whole system forward. So we know what the 5 principles of the Mental Capacity Act are down there at the bottom, but I certainly still feel that there's an awful lot of myth busting that needs to be done around the MCA. So lots of people think of the MCA in terms of the court of protection, big dramatic cases that have occurred there, or they hear it and they immediately get a shudder as they think of roomfuls of solicitors making delivering care all that more difficult and complicated. But I think our take on it is that when you break it down to those 5 principles, it's just reflective of good quality, best practice care that all of you deliver day in, day out. It's there for the protection and empowerment of the individual, but it's there to protect you as well, that if you know that if you're able to demonstrate you're acting within those principles, and this applies to DoLS as well, then you're in fundamentally a good place and the law's there to protect you. So that's very much the way we approach DoLS in the aftermath of the Supreme Court judgment, and I make a kind of impassioned plea not to forget the good principles of DoLS. So I don't stand up here and say that DoLS is perfect. I'm very, very aware that it's not perfect. It's far from perfect, and we wouldn't be on the route we're going down now if it was perfect. But so even before the Supreme Court judgment, when we were having to consider how would we respond to the House of Lords recommendation that we should just scrap the entire system and start again, that did surprise us, I think, in how clear they were and how unambiguous they were in that, because certainly when I'm out and about, I do hear a critical mass of case studies of people who've been through the DoLS process and they have received least restrictive care. Their well-being has improved as a result of that. I fully take it on board that many people will have passed through that system and they were receiving excellent care before, they were receiving excellent care afterwards, but I think it still does deliver benefits for people, and so we don't want to be sacrificing that in whatever changes we do. That being said then, so I came in to post with, as well as the remit on the MCA, with a broad remit to do something about the lack of awareness of DoLS and the fact that the application rate was pretty low. The CQC had been saying for quite a few years that this appears to be too low. We suspect there are people who are unlawfully deprived of their liberty. Variability across the country is huge. Some people returning lots of applications, some people returning next to none. Try and get to the bottom of what the reason for that is and see if we can have a boost in the number of applications in a nice, measured, sensible way. That was my brief, but then it was nicely all done for me when the Supreme Court judgment gave out their acid test. And the official statistics show, we don't hide away from it, 130,000 cases per annum is what we're looking at now. That's a tenfold increase. And when you begin to delve into the stats, the variability is still very much there. I mean, local authorities, I'm going on a bit of a northern tour over the summer. It's not just another opportunity to come back to Sheffield and spend a weekend with my friends, but I'm going up to a few of the, what we'll call the outliers in the country, just to try and get to the bottom of why we have some local authorities who are able to turn around every single one of their applications within the 21-day time limit, some who are unable to turn around even 20, 30%. There's a lot of variability out there, and I'm sure there's a lot we can learn by just trying to patch together the best practice that's occurring in certain areas. And it's very difficult for me to say whether people returning low numbers is wrong. It might be completely right if they're doing, as the lady says, some great preventative work in terms of reducing those restrictions, but there's a lot of work we can do to try and understand things better. Potential for applications from community settings. So ADAS did a survey just after the Supreme Court judgment trying to establish how many people they thought were deprived of their liberty in community settings where DoLS doesn't apply and where you'd have to apply to the Court of Protection. I think they estimated about 35,000, something like that. Applications to the Court of Protection have been less than 250, I think, at last look that I had. So many of you will have a possible theory as to why that is. I personally suspect it's because people in local authorities and providers are focused, frankly, on getting care homes and hospitals sorted, and then maybe if that is solvable, we'll be able to look at into community settings. But we do need to be very careful that we have kind of robust systems of looking through the applications that are coming in, prioritising those of the most vulnerable people, because I think probably the big fear for me and the big fear for you as well is that we might have people that slip through the net who genuinely would really benefit from a DoLS assessment sooner rather than later. Lots of knock-on implications as well, so palliative care, intensive care, coroners, and I'll come on to those in a bit. But the national advice is very tricky for me to give, I'll be honest. This is an area that, as you know, is kind of knee-deep in complicated case law, and picking through it and trying to give clear steers to people is not an easy task. And so I'm constantly nervous of giving guidance which is not in keeping with the case law and which might just get all of us into more difficulty in the long term. But at the same time, where we do see some problems, we try to intervene and where we can and try and give some clear-cut advice. But our overwhelming advice is that we trust professionals to carry out a proportionate response to this. So I am quite aware that applications are not being processed within the 21-day time limit. My great fear at the beginning of all of this was that people would react and take a strictly legal approach, and that would send them down a line of doing things, for example, like going to a care home and doing a bulk application for the entire residents of that care home and just signing it off. I think once we go down that area and down that route and start to think of it in purely legal terms and stop realising that this is fundamentally about people, then we're going to be pursuing a system that doesn't really deliver much benefit to anyone. So my overwhelming kind of urge is that we focus on the quality. You know, DoLS, if best interest assessors are not meeting face to face with people, if there's not that kind of interaction, if there's not that understanding of someone's unique circumstances, if we begin to drift into the territory of, oh, all these people have dementia, that's probably typical of what they're going to, the restrictions that are going to be in place on them, then we really are moving away from the fundamentals of the MCA, which are all about taking that person's unique perspective, best interest, least restrictive, allowing them to make their own lifestyle choices. So I think on the positive side, there has been unified advice from DH, CQC and ADAS, which is that if you are a provider and you are able to demonstrate you're aware of the Supreme Court judgment, if you have protocol, a plan in place to try and work through the backlog, and you're working through that, prioritising people accordingly, then you're in a good place. I think the CQC has said very strongly that if they are finding providers that show good understanding of the MCA, good understanding of the Supreme Court judgment, have a plan in place, trying to get those DoLS applications off where they're needed, but they find technical breaches of DoLS, namely the local authority, because of their workload, has not been able to respond and give the thumbs up or thumbs down. The CQC is not going to come down hard on these people. What they are going to come down hard on is people who demonstrate no understanding of basics in the MCA. And one of the big successes I think we've had over the last year since the House of Lords report has been the CQC taking the MCA a lot more seriously. They have really hardwired it into their new approach, and it's very apparent to my eyes at least that when you look through some of the inspections of care homes and hospitals that are taking place, the ones that are rated inadequate are nearly always marked down for failing on the MCA, which I think is just demonstrative of the fact that the MCA is just core fundamental principles, and if you begin to get those right, everything else kind of stems from it, and that it's borderline indefensible for an organisation to not be compliant with the MCA. I think so fundamental are those principles. So do nothing unacceptable, but you can rest assured that if you have a plan and you're pursuing that plan, we're on your side. So some of the national advice then, so the palliative care one, so this was one of those classic areas of case law that appeared a bit muddled, and we were nervous, but we recognised, speaking to people like yourself, that there was a definite need for some advice. So palliative care, we said that if you're in the last few days, weeks of life, and consent was given to, before you lost capacity, to broadly the care package, with a broad knowledge that that would involve some kind of restrictive conditions on your care, then you can take that as consent to a deprivation of liberty. So you imagine we said that, and lawyers certainly had a good going over of that, and we had to put quite rightly I think, put the important caveat in that if someone has capacity, they're shown their care package, it seems they understand the level of restriction, they consent to it, fine, no need for a DoLS if they're in the last few weeks of life, just abide by the good principles of the MCA, but the caveat would be that if that care package suddenly becomes much more restrictive than they originally consented to, then we're going to have to be back into thinking about whether a DoLS application is the right way to go. Coroners then, the big one, and our Minister Alistair Burt has stood up in his first parliamentary debate on this issue and said there's lots of examples of bad law out there, and this is an example of one of those that had unforeseen implications. So we recognise it's not great, but there are big issues of fundamental, a lot of this can get, when you follow the logic, gets down to fundamental, I think, human rights, and are you ever really going to, people would come up to me and say, A&E settings, no need for a DoLS, let's just get rid of it completely. Well, are we really going to turn around and say that the people in A&E do not have the same rights to an independent analysis of a potential infringement of fundamental rights like a deprivation of liberty that people in long-term care institutions have? I don't think we are. So these things are not always simple, but we said on coroners that yes, as the Coroners and Justice Act says, a death on the DoLS is a death in state detention, but And whilst we would always want a coroner's inquest to take place, a robust coroner's inquest to take place when there's any suggestion of suspicious circumstances, I'm sure we'd all agree with that, we are acutely aware of the potential upset and distress it causes to families. So we get letters in from MPs whose constituents have had examples of a relative dies in the care home, to them a totally normal care environment. They go home that night, so they get woken up at 2 o'clock in the morning because the care home has reported it through a kind of 999 situation. Uniformed officers appear on their doorstep at 2 o'clock in the morning wanting to interview them about a death in state detention. Or equally, we've had cases reported to us where someone, no mention of DoLS at all throughout the entire process. Doctors or nurses have given the go-ahead for a funeral. The funeral's been arranged, families come in from other parts of the world, and then at the very last minute, the system has caught on to the fact that maybe this should have been reported to the coroners, and the coroner's office has put a pause on it, and funerals have been cancelled and people have been turned away. We want to do absolutely everything we can to avoid that happening. So I think the Chief Coroner's guidance is very, very helpful in that it says that a paper-based inquest can happen. It doesn't have to be a jury, it certainly doesn't have to be a post-mortem, but I think the thing that will do the most to address some of this is just local authority leads for the MCA and DoLS, leads in care homes and hospitals, talking to their coroners and getting together kind of good local protocols. So I know parts of the country where it's stated very clearly that if there's a death, first of all, there's that kind of pre-planning so that staff kind of have an awareness of what should happen when this person dies under DoLS, but there's never any suggestion that you would report it out of hours. You would just wait for the coroner's office to open and take a much more kind of pragmatic approach to it. But that piece of the law which demands an inquest is fully in the targets of the Law Commission, and I'm sure you'll have good opinions to feed back to them on that. And then the other area that we come in for a lot of trouble on, or criticism on, is what do you do in intensive care settings. People who have been, say, let's take the hypothetical situation of knocked over by a bus and they're in intensive care. Obviously, they don't have the capacity to consent to any restrictions that are in place on those. And so in that case, we have said quite clearly that a state of unconsciousness in itself, where no other mental disorder, dementia, learning disability was associated, is not a mental disorder for the purpose of DoLS, and so DoLS is not required. And the Intensive Care Society has put out some good guidance as well on that. So the House of Lords told us that DoLS was not fit for purpose. The Supreme Court judgment and the extraordinary increase in DoLS applications since then has reinforced that. Let's not forget that there was a lot of poor implementation of DoLS before the Supreme Court judgment, and that was what we were due to focus on. But I think it became very apparent to ministers. Norman Lamb was our minister before the election. Alistair Burt now very much shares his point of view that this is a priority for law reform, and so who better else to do it than the Law Commission? So Tim will say more about the Law Commission's role, but I should point out they are funded by the department to do this work, but totally operationally independent of government. They are not taking any steers. I am not telling them anything that they should do in the proposals they submit. So I'm as interested as you, and I can genuinely say that we have not formed any prejudgment at all, because we are just highly conscious of the need to take into account practitioners' viewpoints. And equally, that's been one of the reasons why, when we are asked to make quick legislative changes, I'm not sure in parliamentary terms whether there is such a thing as a quick legislative change, but the idea of changing the period of self-authorisation from 7 up to 14 up to 21 days, or extending DoLS in one click of the fingers to all of supported living and community settings, whilst people might think that's sensible, and people might not think it's sensible, I would say to the people who think it's sensible that if there's one thing that the Supreme Court has told us, it's that apparently small changes to the law can result in massive unforeseen implications. And so I'm The department's very keen to protect the space of the Law Commission and not rush into anything that might have unforeseen implications. The chances are busy parliamentary schedules will get one shot at getting this right, and we want to keep everything together so we can make sure that everything reinforces and it's mutually complementary, so that when we do get to this point of introducing new legislation, it's stuff that's going to last for decades, hopefully, before we need to revisit it. But, so that being said, I think the department is quite clear about some of the broad things we want to see, and I don't think that's not a case of influencing the Law Commission. I think it's just a case of stating the obvious, and one of the statements of the obvious is that you can find the impact assessment that the Department of Health produced for DoLS back in the day before it was introduced, and it was very much based on the premise that a deprivation of liberty is a rare occurrence, therefore we need quite robust gold standard safeguards to make sure that where a deprivation of liberty occurs, it's in the best interest of that individual. It's now abundantly obvious that it's not a rare occurrence, and so do we need a new system, a different system to address that? DoLS is a one-size-fits-all system. Is it really right that we have a system that applies in exactly the same format in an A&E setting where people might be in and out in a matter of hours, days, that applies to a long-term care setting where people might be there for weeks or not months? These are some of the big questions that the Law Commission are looking to address and that they'll be seeking your views on. But I think our fundamental challenge, what we want to see, is a system that balances the need to deliver safeguards to everyone who's eligible for them. There's no point in having gold standard safeguards that we manage to deliver to a few thousand people whilst queuing up outside the door of another 10,000 people who are never going to receive any safeguards because the system just can't deliver them. So we need to have something that protects individuals but is balanced at that population level, minimises the bureaucracy, gets rid of some of the oddities within the system that which cause you so much trouble on a day-to-day basis. So we don't want to rush legislative change. We want the Law Commission to take a comprehensive approach to this. They are in the driving seat. Many of you, I know, one of the questions is always, when does this come into force? When does a new system come into force? So our new minister, who is very passionate about this area, it was a good opportunity for me that his very first parliamentary debate in his new job following the election was on DoLS. Very technical area, as you can imagine. I find it hard after 2 years to go face-to-face in a robust debate about DoLS because it can get so technical, but good opportunity for him to get very much into the detail of this, and one of the first instructions from him was to accelerate the Law Commission's work, because we recognise that this is not something we can hang around on, whilst balancing that against the need to make sure we take everyone's views into account. So Law Commission will report in the form of policy proposals and a draft bill to go into Parliament at the end of 2016, and then the plain and simple answer is that government, cabinet level, needs to decide how quickly do we prioritise this work, how quickly do we get it onto the statute book. And so obviously as the policy lead you might imagine that I regard this as a priority, but I would encourage you to keep it top of the agenda. That will only help these things move along. Obviously then it will go through Parliament, and government doesn't control Parliament. We know that when things go forwards through Parliament, there'll be amendments put down, House of Lords, House of Commons, and so it'll be very important for your organisations, I think, to make sure that you keep that practitioner viewpoint coming into those legislators and make sure that what turns out at the end of the day. But if you were to ask me the earliest, if everything goes to plan, the earliest that this new system could become into force, I think we were looking about April 2018. And obviously, of course, brand new legislative system would come with a brand new code of practice, and we would be needing your help to really translate the principles on paper into something that you could implement on the ground. So my conclusions are that I don't think anyone argues with the principles at the heart of DoLS. People hear the term deprivation of liberty and think this is some god-awful thing designed to keep vulnerable people locked up. I'm constantly having to tell people that although it's a difficult narrative, a deprivation of liberty can be an entirely appropriate thing and entirely right for that person. If they are a person with advanced dementia who has little understanding of road safety, we want to keep them deprived of their liberty because we don't want them coming to harm. But based in the MCA as this is, we do also want to put a very strong emphasis on the empowering principle of the MCA. The House of Lords was highly critical of the culture in the health and care system to be risk-averse, to be paternalistic, to always tend to look for the safest option, even if that was an option which would not make that person as happy as they potentially could be, allowed a bit of risk, but allowed to take those lifestyle choices. But the question now is, how do we make it work for real people and within the context of the current health and care system? No one wants a system where people are just being put through for the sake of becoming legally compliant. The law is not there to cause us work. The law is there to protect and empower people who lack capacity. So we need to make sure we get that balance right. I was going to, I could talk about the wider things we're doing on the MCA for quite a while, but I would encourage you to look at some of the things we're doing. We've recently launched an online directory of all MCA materials. If you type into Google, MCA directory, it brings up a very good new web resource where, filtered by different professional groups, you can get good toolkits, good guidance. In time, it's going to evolve into a bit more of an interactive element that people can share practice concerns. Have a look at that. They're still taking submissions. If you have best practice materials that you have, which you think would be useful for people around the country, upload them there. And we're making some progress with medical professionals. The Academy of Medical Royal Colleges has made a great step forward in making sure that the foundation curriculum for newly qualified doctors now includes the MCA. So every single doctor, no matter what speciality they go through to, will be trained specifically in the MCA. I hope the knock-on effects of that down the line will be quite profound as we get this new cohort of medical professionals who are a bit more au fait with this type of thing, getting a bit closer to, as the House of Law said, the social care field, although we'll have work to do. And social care as well. Our Chief Social Worker, Lynn Romeo, is very, very passionate about this, and she has redone the what's called the Knowledge and Skills Statement for newly qualified social workers, and at the absolute heart of that is a good, deep understanding of the MCA. And our big, aside from all the reform of DoLS, our big thing for the coming year is the launch of what we're calling our new National Mental Capacity Forum, which I'm always conscious when I say that sounds like a classic governmental term for some talking group organisation, but we do have big hopes for it. The House of Lords criticises that we didn't have this ability to kind of bring together different people from the wide range of organisations that are affected by the MCA. So how do we get frontline banking, high street banking people, someone walks in who lacks capacity, wants to withdraw their entire life savings, rather than just turning them away onto back out into the community? How can we make sure that they are better linked up with social services, with third sector organisations who are able to build a bit more of a network around there? Police, often not involved enough in conversations about the MCA if they're picking up people who lack capacity in the community. How can we make sure that these people aren't spending a night in the cells whilst we find a suitable place for them in social care? How do we make sure that that's much less traumatic and that the two organisations work together? So we're selecting an independent chair. We're big on independence at the moment, so we'll have a new independent chair that will be announced by government in the next few weeks that's going to lead this organisation. But you're all welcome to join. We're not putting any limit on the membership because we want as many people in as possible. I already have an inbox with about 150 people who want to join this group, and we're hoping to turn it into a bit of a national movement. But that's my conclusions. I think we're genuinely open to getting your thoughts. I know it's been difficult. I know that the frustrations of the DoLS process can certainly get me down a bit at times when you see something that just you wish you could change that and just get it working in a functional way. But I think we're on a journey towards that. I think we need to make sure that we hear your views properly and get a system that works for the future. And I fundamentally do think that this type of process, shining this light on people. I mean, we must remember that there are care homes out there who are, doing absolutely best practice. I was lucky enough to visit St. Luke's the other week, and you can see organisations where the MCA is just firmly embedded, but we all know full well that there are organisations out there that don't have that much scrutiny of what's going on in there, where those principles aren't embedded, where people are treated as numbers. And through, I think I don't make any apology for making organisations think more about restrictive care, think more about what it means, think more about empowering people and realising their human rights. And I think I wouldn't be doing this job if I didn't think that what we're doing here can bring around some of those positive benefits. So I'll leave it at that and look forward to getting any questions. I shall try my best to answer them, but I'm always looking for material for a kind of another letter out to the field to try and add some clarity to what's going on and help you through the next 2 years before we get, hopefully, a system that's fit for purpose. Thank you very much.